Hello, guests. Welcome to the Mental Illness Awareness Podcast, Episode 1, brought to you by Paramedimarist. I'm Timothy Tan of 9-3. Today, I will be talking about anorexia. This includes general information on anorexia, signs and symptoms, statistics of anorexia, and treatment of anorexia. Anorexia, also known by its scientific name, anorexia nervosa, is a psychiatric disorder identified by abnormal eating behaviors and forcing themselves to lose weight. People with this illness have an extreme fear of gaining weight, which causes them to try and maintain to a very low weight. This mental illness is an emotional disorder that focuses on weight, but many researchers believe that it is an attempt to deal with perfectionism. People with anorexia often feel that their self-worth is tied to how thin they are. This illness is increasingly common, especially among young women, as modern ideals encourage women to be thin. A growing amount of men are getting affected by anorexia because of popular fixations with lean bodies. There are a wide range of signs and symptoms of anorexia nervosa, which can vary from physical signs and psychological and behavioral signs. Some physical signs are fatigue, low blood pressure, excessive weight loss, abnormal heart rhythms, and much more. Some psychological and behavioral signs are refusing to eat, inability to remember things, depression, distorted self-perception, and more. The things to watch out for when looking out for this illness is skipping meals or making excuses to eat, refusing to eat in public, compulsive exercising, and constantly weighing yourself. Here are some statistics on anorexia. Anorexia has the highest mortality rate on any psychiatric disorder. Approximately 1 in 100 girls develop anorexia nervosa. 1 in 10 young adults and 25% of children diagnosed with anorexia are male. The average duration of anorexia is 7 years. Those who recover are unlikely to return to normal health. 1 in 5 premature deaths of individuals with anorexia are caused by suicide. Although 70% of patients regain weight within 6 months of the start of their treatment, 15 to 25% of these relapse within 2 years. Almost 1 million Australians suffer from eating disorders. And in 2012, the research suggests that 7,000 to 2,500,000 Australians with anorexia were male. The most successful treatment is a combination of psychotherapy, family therapy, and medicine. It is important that the person with anorexia is actively involved in their treatment. A combination of treatments can give the person the medical, psychological, and practical support they need. Also, involving friends, family members, and others in the treatment may be helpful. And that's the end, folks. Help others that suffer from this mental illness by supporting them through their tough times and also their treatment. I hope you have learned something about anorexia. Thanks to Paramount Mars for sponsoring this broadcast. I'm Timothy Tan, and thank you for listening. Join in the show next week.